hopefully we go on without a glitch here, because we all know technology is a little tricky, but we're doing the best we can. So again, those that are just popping on now, question and answers to the right. We already have one coming in. We'll address that once we get started. And I want to introduce Pat Nemia from the Federation of Children with Special Needs. Thank you, everybody, and I'll say goodbye at the end.
Thank you, Andrea. So welcome, everybody. It's a little funny because I can see Andrea's box and my slideshow. So I don't see you, but nevertheless, please put your questions. Andrea talked to you about the chat on the side, the questions and answers. Put your questions in as we go on, and Andrea will pause me, and we will answer the questions. I love for this, it's kind of funny for it to be a little interactive, but I would like it to be interactive and have the ability to talk to you and answer your questions. So as Andrea said, I'm from the Federation for Children with Special Needs. I hope many of you have heard of our organization. We work to kind of address the needs of children with special needs in the education, the healthcare, the community sectors. So we really try to provide families with education and empower them to be able to make the best decisions for their children in all those areas. Oops, let's see what's happening here now. Why isn't there we go. This is just some general information about the Federation. When you get the recording, I'll leave it to you to be able to look at it. My project with the Federation for Children with Special Needs is Mass Family Voices, which is a grassroots organization that really looks at empowering and educating families around navigating the healthcare system, whether it's access to healthcare financing or access to resources, access to just how to make better decisions in navigating the healthcare system. And so we work with families to educate and inform them in that area. The Family to Family Health Information Center, which is what all those letters stand for, is the grant that funds Mass Family Voices at this point in time, and these are some of the things that we do. I'd like to point out in particular the Mass Family Voices listserv. The listserv used to be on the Yahoo platform, so many people have belonged to that through the years, and it was a really good kind of networking discussion platform for families, but Yahoo has changed their platform and a lot of things have gone away. So we've opted to go to a Facebook closed group, which is part of the Federation for Children with Special Needs. You have to ask to join, but it's a really good place for parents. We like to post information or things that we think are happening or really new news or breaking news types of things that family might need to know. But it's also a place for families to ask questions, and it's a closed group. You might have questions about a supplier or a school or something, and it's a place where families can pose questions and get information and support from other families. So it's something that I think is a really good tool for families. I would really like to see it well used. So I will send the information when Andrea sends out all of the information after the webinar. So today we're going to talk about healthcare financing. We're going to look a little bit at commercial insurance, types of MassHealth, who's eligible for different types of MassHealth, what do you need to do to apply for MassHealth, premium assistance and how to apply. And then we're going to talk a little bit about, or focus a little bit on how that changes when your child is turning 18. So healthcare is really the foundation of everything. Healthcare is the maintenance and improvement of physical and mental health through the provision of medical services. And so we all know, that a child, a young adult, health is important to the success of the other things in their life, and even especially through transition. Healthcare, the ability to be independent in our healthcare or maintaining our healthcare is really important for kids and young adults, and because it is what will enable them to participate in school, to participate in recreational programs, to participate in work. So it is the foundation. And we know that to get to healthcare, the gateway is health insurance. So we just say, what are health plans? So health plans are a type of insurance that an individual buys to pay for the cost of medical treatment if you're ill or injured. Now, just because you have it, we know that healthcare plans are not universally the same. They don't all cover everything. And so when you have a child or a young adult with special health needs, whether they be physical, whether they be mental health needs, whether they be medical needs, you need to look at your health plan and you need to ask some questions. What are the services that my child, my young adult needs on an ongoing basis? Will they be able to access them through this health plan? Should I consider other health plans so that I'm sure my child can access them? And then what is the financing, or what is the cost to me for all of this? So just to talk a little bit about the history of insurance mandates. So really, Massachusetts was at the forefront of mandating that everybody have healthcare insurance. And it started in 2006 with Governor Romney and Senator Kennedy, and it was rolled out in Massachusetts in 2007. So the healthcare mandate was rolled out. Everybody had to have health insurance, or they suffered a tax penalty. In March 2010, President Obama signed the Patient Protection and Affordable Care Act into law, and that basically said the same thing. So that it was signed in 2010, it was rolled out in 2008, and it stated that all adults and children had to have health insurance or face tax penalties. And they introduced a number of ways through the Affordable Care Act for people to get health insurance, including the marketplace, where you could apply, your finances would be assessed, and you could potentially be able to purchase health insurance at a more affordable cost. But that has changed. While the Affordable Care Act is still the law of the land, the individual mandate has been suspended as of 2019. So there is no longer any penalty if you don't have health insurance. So what is it that a health insurance policy needs to be in order to be considered coverage that, that is adequate? So the Commonwealth describes minimal credible coverage, which is the standard, the minimal level of benefits that you need to have to satisfy the mandate that you have health insurance. So for example, if you bought a health insurance policy and all it did was cover hospitalization, the state would say, well, that wouldn't meet our minimal credible coverage, because you wouldn't be able to pay for doctor's visits, screenings, assessments, all types of things. And so there's an outline of what minimal credible coverage is. The website is here, and it gives the list of what you need to meet to be considered meeting minimal credible coverage. And one of the things also in this is the state describes how much out-of-pocket money a person has to pay to meet minimal credible coverage. Now, there are some organizations, there are some situations where employers may be exempt from some of this, in very small businesses. That's an example of one in which an employer may be exempt from some of the standards of the law. So you need to be aware of that depending on what your employment situation is. So we're going to basically talk about types of insurance plans today. And we have kind of two major buckets, and they're private or commercial plans and government-funded insurance, right? So private or commercial plans you may get, and the majority of people who have private insurance plans get them through their employer. And there's two types, which we will talk about in a little bit. There's a self-funded and a fully funded plan, depending on, it's really how your employer administers the healthcare. It's not really about coverage, and we'll talk about that in a second. And you can have an individual plan. I mean, you can pay for your own private insurance. Now that is astronomically expensive. If I were to call Blue Cross Blue Shield and say, oh, I just want an insurance policy, that would be very, very expensive. But you may be able, as we said before, if you don't have an opportunity to have a private plan through an employer, and you don't qualify maybe for certain government funded insurance, you may be able to buy an individual plan through the marketplace. And then government funded insurance is usually what we think of globally as Medicaid. And it's federally and state funded. In Massachusetts, it's called MassHealth. And it's interesting, Medicaid is not universal state to state. So there are federal regulations about the distribution of money through a state's Medicaid program, which every state adheres to. But then there are also waivers that states can apply for to ask the government if they could spend money in other ways, and also to expand beyond what the government regulations are for insurance. So a state can submit a waiver to the federal government asking to expand coverage to an additional group of people or for additional services. And that's what differs state to state. So when we talk about children and youth with special health needs, and this also applies for young adults, there's basically three kind of scenarios that we see people falling into in the type of insurance that they have. So I just want you to keep this in the back of your mind as we talk about it, because we're going to go more in depth in each one of these. The one scenario is that a family, an individual, a young adult has private insurance. They just have private insurance. That's, you know, they pay for it through an employer or themselves, and that's what their coverage is. There are situations in kind of the middle where there may be private insurance, but the private insurance, because there are special health considerations, the private insurance may not be comprehensive enough. And so in Massachusetts, you can add to that a government supplemental plan, which is called CommonHealth. So we see a lot of people, a lot of children, young adults in the Commonwealth having a private insurance and a supplemental plan combination. Or you may be in a situation, the third bucket is that you qualify for MassHealth as your primary or comprehensive insurance. And so people tend to fall in those three categories, and that's what we're going to delve a little bit more into right now. So private insurance plans. And the ones that I'm talking about today will be those that are employer-sponsored plans or the plan that you get through your job. And there's basically, you know, and then we think of who are the big players in that: Blue Cross Blue Shield, Tufts, Partners, you know, those are all offer private insurance plans. They may also offer some government funded plans, but they do offer private insurance plans. And there's within the administration of those plans, you fall into one of two groups: either fully funded health plans or self-funded health plans. So we're gonna talk a little bit about what these two are, and then I'll explain to you why you need to know this. So in a fully funded plan, it's the way the money flows that differentiates them. So in a fully funded plan, I'm an employee. I work at my company. Let's pretend it's GE. I work for GE. So what happens though is the employees have money taken out of their paycheck every pay period, and that money goes directly to a health insurance company. So like it goes from the money that would have been paid to me is taken out, and GE sends it to Blue Cross Blue Shield or whatever the insurance company, and then that insurance company it holds all the money for the employees at that company, and they pay out all of the premiums. So for your hospitalizations, your doctor's visits, whatever medical expense you have, the insurance company pays it. So the flow of premiums is really what we're looking at, is from the employee to the health insurance company, and then to cover whatever service was provided. So that is fully funded. A self-funded plan, the flow of the premiums is a little bit different. So I'm an employee, money from my health insurance is taken out every pay period. That money, I pay the premium back to my employer, so GE. So GE says, you know what? We don't need the health insurance company to hold the money and to pay out the claims. We can do that. And so what they do is the premiums flow to the employer or the company, which that keeps the money, and they're the ones that pay the claims to the providers. Now, they do usually, because you say, well, I have a self-funded plan, but I still have a Blue Cross Blue Shield card. I don't understand what that is. And they just usually kind of almost, I don't know if subcontract is the exact word, but you know, they basically bring the health insurance company in to manage the plan, but they're holding the funds. So in larger companies, this is a situation that works a little bit better for them, especially when in a large company where you have a lower risk pool, because you may have so many young people working for you who you know are relatively healthy. And so keeping the money in-house is a better financial decision for that company than giving it all to the health insurance plan. So we usually see self-funded plans in larger companies, universities, potentially hospitals, that they use this plan. Now, many people will go through their life not knowing or not needing to know how this is administered. Where it becomes important, or why do we need to know, is a couple of reasons. And I think the biggest one for our population is Department of Insurance regulation. So the Department of Insurance in every state sets regulations that health insurance companies must follow. And so the Department of Insurance has authority over fully funded plans because it's the health insurance company which is administering everything about the plan. But in this situation, the health insurance company is really just a contractor of the larger corporation. So these self-funded plans do not come under Department of Insurance regulation in Massachusetts. And so that can be, we'll look in a second, that can be impact children, youth, and young adults with special health needs. And another thing that can occur is it can affect the appeal process. Like they can develop their own appeal process, which may be different than the one that the Department of Insurance has required of fully funded plans. So I've made this kind of graphic to summarize. So if we have employer-sponsored plans, we have self-funded plans and fully funded plans. We've talked about those two. The self-funded plan, the money stays in-house with the company. They're not subject to the regulations. Fully funded are subject to state insurance regulations and laws. And two examples of where that has become important or impacted people is, so for example, we know that the Eureka law was passed in the state of Massachusetts and requires insurance companies to pay for services for children with autism spectrum disorder. And so that is only going to apply if your insurance is fully funded. And the same thing with changes, and I'm sorry, this should be BHCA, but changes to behavioral health services, where the state is now requiring that private insurance companies pay for certain behavioral health interventions. Well, that is only going to be in this fully funded group. So you need to think about if you're in a situation where, and in the children and youth with special health needs and the young adults with special health needs, in that population, there is active regulation and active legislation going on to increase coverage or mandate that coverage must occur for different services. So you need to just be aware of whether or not you fall into that category. Now, the good news is that a lot of self-funded plans, while they're not mandated to cover it, we do see over time that if the fully funded plans are covering it, as they start to, it may take a year or two, but we do often see that the self-funded plans will then also include it in their coverage. So we do see a trend that it does ultimately wind up being covered by everyone, but it doesn't have to. And so that's something to just be aware of when you're thinking of your private policies. So just to go a little bit deeper into explaining this behavioral health for children and adolescents, this happened just in the last year or two. It started in 2018 with a memorandum from the Department of Insurance, and it's now saying that in the past, behavioral health services, a lot of them, especially the in-home health services, so what a lot of people refer to as the CBHI services, were only covered by MassHealth. And so everyone had to apply for a MassHealth supplemental if they had private insurance to be able to get these services. And so that was the impetus to change this. And so the organizations that were involved, Department of Insurance, Department of Mental Health, and the fully funded insurance plans kind of came together. And the Department of Insurance said, okay, we're changing this. And we're requiring that certain behavioral health services be paid for by insurance plans. So things like in-home therapy, mobile crisis. And then in 2020, additional services were going to be added, and those were going to include family support and therapeutic mentors. That was a little bit later in rolling out because there was some credentialing issues and who would be able to bill and be paid. So those services are now supposed to be are being covered by fully funded insurance policies, which is a really important step for the state. So if you have questions, and what I'm going to do is send to Andrea a bulletin that went out from the Children's Mental Health Campaign that the Federation assisted with, and it'll list all the services for you, so you'll have a chance to see them. Usually when I'm in person, I have all these handouts so people can look at them. But and as I said, July 9, 2019 was the first phase of these services, and July 2020 was the second phase of services. So Andrea, let me see where I am here. And so this is what I was saying, families should check with their insurance planner or employer's human resource department to find out, if your health insurance covers these important services. So if, you have a Blue Cross Blue Shield policy that now is a fully funded policy that is now required to cover them, I would call them and say, I'm wondering what's going on with the behavioral health for children and adolescents. I would like, I think my child needs these services, and I would like to understand if you now have to cover them. And if they say, yes, we do, then they're required to have developed a network. This started, as I said, in July 2019. They were required to have a network up and running and be able to provide families with choices. If you don't have a fully funded insurance, in this situation, you will still be able to get, and you had MassHealth and you were getting these services through MassHealth, you will still be able to continue to use that route. And
Pat, I do have a question that came in, if you don't mind.
Sure, go ahead.
About this specific topic. Do any of these additional services apply to adults also once a child reaches 21 or age 26?
So this was for children and adolescents, and so this was for younger. This is for children. There are a number of things actively with a number of different groups in the legislation trying to extend that.
Okay.
So as of right now, this is for children.
Okay. And the other question that came in, I understand I can have my child on my private insurance until 26. If my child is disabled, can he stay on longer?
So we are going, if that person doesn't mind waiting 2 slides, I'm going to get to that.
Perfect.
Okay, great. Thank you.
Yep.
So, and what happens when you enroll? So I just wanted to, when you enroll in an insurance policy, a private insurance policy, and this is important, especially if it's the only policy that you have and it's covering your child or young adult. You choose a plan when you first enroll, and I encourage people to look at those plans. What's the coverage? So think about, partner with your young adults and include your young adult as much as possible in the discussion of, what type of ongoing healthcare are you involved in? For some people, it may be a visit every 3 months. It may be, updates in medication. And for other people, it may be involve, more frequent visits, more subspecialists. But what are you looking at? And look at the policies and then say, okay, am I sure that these policies, when you look at your private choices, cover what I need? Because there's different types of plans available. And so you may say, well, I'm not going to do that because it's too expensive. I'm not, going to do that. But then I just encourage people to think about a little bit, okay, but what is your out of pocket if you choose to go with a less expensive policy, but then you wind up paying for a lot of the services that you find out your child or young adult needs. So it's a puzzle. It's always a puzzle. But I put this slide here just to encourage people to think about that. It's not always the best choice just to get the less expensive one, and it may wind up actually being more expensive. And then you renew your plan every year, and so it's important again to look at what the plans are saying. Have there been changes for the better or not? And what do you need to think about? And so commercial plans, there's positives. There's an opportunity in many situations to get a very comprehensive coverage. With commercial plans, people report that sometimes they can get access to services in a more timely manner, and there may be more flexibility in provider choices. We know that there are not as many MassHealth providers in certain sectors, in the behavioral health area, in a lot of the therapies like PT, OT, speech. There's not as many people or providers in the MassHealth arena. But again, concerns are a little bit the same. Concerns can be coverage. You know, I can't afford coverage and premiums that kind of go hand in hand. You know, what is the cost of this insurance? What can I afford? What is the coverage, what I need? And then you always have to think about your copays and deductibles and look at that as part of it when you're purchasing your private plans. So now, yes, I think I am here. So private plans, when your child is turning 18. So your child may have their own individual health plan, not turning 18, yeah, turning 18, sorry. Thinking 26. So when your child turns 18, they're now the age of majority, they are now an adult. And so they may, in the private sector, if they're working, they may choose to carry their own insurance through their employer. They may not have options for healthcare, and they are working, and so they may look to the Health Connector for a policy that would be affordable for them. So there are options for them to branch out and have their own individual health plan, or they can remain on their family health plan. And all children can remain on until they're 26 years old. But there is the opportunity to remain on longer, but your child, disabled adult children may be eligible to remain on a family plan after age 26. And there is, you know, a lot of what we look at in disability once a person is an adult is capacity to work. So disability is defined around capacity to work. As a child, it's defined around functional status. So capacity to work. So if you have an adult child who does not have the capacity to work, you may apply to your insurance to your insurance company to have that child remain on your insurance policy after the age of 26. And what I would encourage families to do, if that is their situation, is to contact, don't wait until your child's 26. Contact your insurance carrier a little bit earlier, ask for their policy. Now they have to have a policy, but find out what their policy is, find out, you know, the definitions that they have. For example, gainful employment, you know, disability, these types of things, and find out what you need to submit to them, because you will have to submit documentation. And so you want to make sure that you put that all together so that you have what you need. But it is possible for your child to remain on your insurance plan after 26 if they meet the criteria. So does that answer the question, Andrea, or is there a follow-up?
Is that the same for a self-funded plan?
Yes. So I believe, yes, it is. But what I would do is I would contact your health insurance, because it's not a state regulation. So that's part of the Affordable Care Act. So, but again, my expertise is not in all of these individual health plans, I'm sorry, but what I would encourage you to do is there is an avenue for children to remain on, for adult children to remain on after 26 if they are considered permanently disabled. I would contact your insurance plan and say, you know, what is your policy and what do I need to submit for consideration?
Yeah, I think,
Okay.
yeah, I think that's addressed it so far. So if I hear anything else, I'll let you know.
Great. So now we're going to move out of that bucket. And if you remember, I had 3 buckets. On the left side was private, and on the right side was government funded. So I'm going to go to the government funded, and then we'll come back to the middle with the combination of the private and supplemental. So government funded plans, as I've said before, are generally what we consider Medicaid. And I'm sorry, because there's a lot of words on this, and I'm always, and in actuality, it's better when it's on a webinar rather than on, you know, the big screen in a room. But Massachusetts Medicaid, which we also refer to as MassHealth, it pays for health care for certain low and medium income individuals living in Massachusetts. So MassHealth has a program that pays for people that are financially eligible. They meet a threshold where they are considered not able to pay for health insurance. And that is kind of what we think every state has some form of this type of program. It offers different types of coverage based on your age. If you're a parent, pregnant, disabled, HIV positive, breast cancer, cervical cancer. So we're going to look at the different types of programs, but there are many types of MassHealth programs, and you have to see what you fall into. MassHealth is the person that decides if you are eligible, and they give you the most complete coverage. So what happens, why I put that up there, is when you apply for MassHealth, based on your answers, the computer generates what they believe your coverage should be. So they look at the financials, they look at whether or not you said you're disabled or your child is disabled, they look at whether or not you have private insurance. So all these answers that get put on a MassHealth application are sorted, and the computer decides. This is important, and I'll talk a little bit about it later too, but this is important because when people think, oh, I'm applying for CommonHealth, or I'm applying for this. There is no way to say that to MassHealth. So when you're filling out your application, you have to be aware that you fill out questions accurately and appropriately, because if you fill it out and it's not right, it could switch the sort. So it's just, if you have questions about an application, you're really not sure how to fill it out, you can give me a call. And if I don't really know, I have a lot of references, people that we can call and get us the information right away. So MassHealth also offers healthcare benefits directly or by paying part of all of your insurance premiums. And MassHealth is always the payer of last resort. And that's something you have to remember. So what does that mean? It means that if there's any other mechanism that you have or are eligible for to pay your health insurance, MassHealth is going to say you need to do that. So you know, if you have primary insurance, MassHealth is saying, okay, you need to use that first, and after you use it, so for example, if you CommonHealth, then we'll pay the remainder of the things, or we'll pay for things that aren't covered. But you have to exhaust the use of your primary insurance first. And the reason that that's important, we'll talk a little bit about CommonHealth. It means that if you have private insurance and CommonHealth, or private insurance, and as kids get older, they may have MassHealth standard that they're using in combination, the provider you go to has to accept both. So they have to really accept your primary insurance to have a mechanism for the provider to bill MassHealth. Okay. So I put this up here, and it's a lot, but I put it up here because it's a really good summary, and you can go back and look at it when you get the webinar. You can look at this slide or print it out if you would like to. But it basically shows you that there's all these different types of MassHealth. There's not one MassHealth program. There's all these different programs, and it tells you basically who's eligible. So if we, you know, if you read through, you have to see if you fall into that category. Everyone must be a resident of Massachusetts to qualify for MassHealth. Some of them are based on financial eligibility, and some are not. So, for example, MassHealth Standard, which is probably the most comprehensive care that you can receive, does have a financial eligibility criteria. Family assistance does. You know, MassHealth Care Plus One, which is for adults, does. But MassHealth CommonHealth, which is a supplemental, and Kaylee Mulligan, which is a program for severely disabled children requiring skilled nursing at home, they don't have financial requirements. So there's other, you know, you have to look back to, you know, what is the eligibility? So they all have a citizen or eligible immigration status that you must meet. And we see this a lot in underserved communities, that this is an issue, because if you don't have an eligible immigration status, the only things that you would qualify for are MassHealth Limited, which is basically emergency care. So you go into the emergency room, or you have an emergency procedure, a hospital would have a mechanism to bill MassHealth for that, but it's not going to cover any kind of regular visits, screenings, testings, any of that, therapies. So it's a very limited healthcare that people have, and that becomes an issue for children and youth with special health needs if they fall into that category. And Children's Medical Security Plan is another plan that people who don't have eligible immigration status can combine with MassHealth Limited, but again, it does not provide all of the services that a child with special health needs may require. So you see that there's all these different types. So it's important in looking at them that you remember that this is what the computer is sorting for. And so if you're filling out an application or helping people that fill out an application, you need to be aware that of what they're asking and how to answer correctly. Okay, so we just looked at the types of MassHealth in that big chart, but the MassHealth that we usually talk about with regards to children and youth with special health needs or young adults who are disabled and have received a disability determination from the state, usually we're talking about MassHealth Standard as their coverage, MassHealth CommonHealth, which is a supplemental, or Kaylee Mulligan, as we said, which is a separate program with a separate application, but is for individuals who are requiring skilled nursing or advanced technology at home. Kaylee Mulligan began because parents who wanted to have their children at home but required such a high level of care that they would be institutionalized, it was a mechanism of reuniting families. And so through Kaylee Mulligan, there's a payment for these expensive extra services that are required on an ongoing basis for these children and young adults. And so it was a way of reunifying families and having a child or young adult be part of their home. So understanding kind of some of those basics about MassHealth, we're just going to talk a little bit and focus in on MassHealth Standard and MassHealth CommonHealth. The biggest difference between the two, MassHealth Standard is a primary comprehensive coverage. If you have MassHealth Standard, it's the same as if you were to have a private insurance policy. It is your primary, it is your method or your one insurance policy. But to be eligible for this, there is a financial eligibility that an individual or household must meet. MassHealth CommonHealth, which is another insurance that we want to look at a little more closely, is a supplemental or secondary coverage. Now, the interesting and the good thing about this is MassHealth Standard is kind of like the golden policy in MassHealth. It is the most comprehensive. It covers the most services. The good news about CommonHealth is that even though it's a supplemental, it covers the same services as MassHealth Standard. The eligibility for MassHealth CommonHealth is that your child has a qualifying disability. And so you will get it and you can use it in conjunction with a private policy. So in talking about, I like this slide and I just put it up here and talking about coverage rather than listing out all the coverage. I kind of stole this slide from Blue Cross, but it looks at, if you have a typical private insurance policy, these are the things that are covered. And but with MassHealth, whether it's MassHealth Standard or whether it's CommonHealth, these are the extra benefits then that MassHealth covers. And these are important to our community because it's long-term supports and services. It's behavioral health services, mental health services, some transportation to medical appointments and dental services. So really things that, the community of children, youth, young adults with special health needs really need to have covered. And so think back to what I was talking about when you're looking at your private insurance, think about these additional benefits and are there policies that allow you to have that? And what's the financial implication of buying that policy versus a different policy and adding CommonHealth with a premium? So it's always a puzzle, but think about the benefits that your child or young adult needs. Think about the services they need and putting the pieces together, what situation works for you. I put this up here because this is a reason that many people look to MassHealth, whether it's MassHealth Standard or CommonHealth, as a form of coverage, because for years, now this is changing because we just talked about that certain private insurance policies are going to have to begin to pay for these services, but MassHealth does cover these behavioral health services that have always been called CBHI or Children's Behavioral Health Initiative. They're starting to trend away from that a little bit and call that office the Office of Behavioral Health. I don't know if they're ever going to get any of us, or if they're going to be able to get us all to make that switch in our brains, but these services are covered by MassHealth. So if you don't have a private policy that covers it, you need to think about it, and these are services you really need. What private policy do you need to get and combine with a supplemental plan so that your child can receive these services? And the other thing that I wanted to bring up at this point is that, you know, we know that MassHealth standard, so there's two types of, when you apply, if you financially qualify for MassHealth standard, that's great, right? Most comprehensive program through MassHealth, good news. But many families, when they apply, don't qualify for MassHealth standard as their primary coverage, and instead are offered family assistance, which comes with a small premium. I think it's like $30 or $40 a month per child. But the important thing to understand with family assistance is that it is not as comprehensive a policy as MassHealth standard. And so things like behavioral health services are not going to be covered under family assistance. So when you're thinking about what MassHealth offers you, one of the things to think about is, what is it my child needs? Always go back to, you know, what does my child or young adult need? And if I'm not going to have the most comprehensive coverage, is family assistance going to be enough? Or do I look into some form of private insurance where potentially I can use a supplemental insurance with it, and then maybe get premium assistance or a program in the state that helps me pay my premium? So think about, don't just take what's offered. Think about it. Think about it if the coverage works for you, because what families often talk to me about is, oh, you know, I didn't get MassHealth standard, but I got family assistance, and that would be better for the kids than putting them on my private insurance financially. But now I have all of this out of pocket that I didn't expect, or I can't get these services at all. So it's important, if you yourself or you're working with people, to think through all the options based on what a child or what a young adult's needs are going to be. So MassHealth standard, so let's go back. You are offered MassHealth standard. Your child is offered MassHealth standard, and as a child or as a young adult, and you say, great, this is a good program for me to be in. What happens? Well, you'll get an enrollment package in the mail that will ask you to choose a plan when you first enroll. And there's many different types of plans, same as if you worked at Blue Cross Blue Shield or you got a policy through Blue Cross Blue Shield. They have different types of plans. The plans are accountable care organizations, managed care organizations, and primary care physician plan. And I'll go to a slide that talks a little bit about them, but you're going to, again, think about the services you need, where your child or young adult is getting those services, which one of these plans do you fit into the best. And then you're going to renew the plan annually. So you're going to be renewing it for your child, or your young adult will be doing it. You will be assisting them, but the plan's renewed annually. So every year you have the opportunity to assess and say, did this work for us? What did I say I would have changed if I had the opportunity? So you need to think about that. So as I just said, there's different types of categories of plans. There's accountable care organizations. There's 17 ACOs across the state of Massachusetts. There's managed care organizations. There's 2 of those in Massachusetts, and there's the primary care clinician plan. So the accountable care organizations are relatively new. I believe it was 2018 when MassHealth rolled them out. And it's a model of care that's different than perhaps what MassHealth offered before. So I think the model of care that you see in like primary care clinician plan, it was more of a fee-for-service model. So I have MassHealth. Dr. Jones is a pediatrician who accepts MassHealth. I go to him, he sees me, he gets paid, fee-for-service, right? I want to go to an orthopedist, I get a bunch of referrals, I find out who from the insurance, from the, who are MassHealth providers. I pick one, I go, he sees me, he gets paid, right? So there's one of the things that kind of is missing in that plan is this idea of coordination. And that's where the accountable care organizations come in. Accountable care organizations is a little bit more, I mean, I think we see this, I don't think they call it this necessarily, but we see this a little bit more in the Medicare field, where the ACO or the health plan, so for example, Boston Children's Hospital has its own ACO. So Boston Children's Hospital and all of its satellite places across the state, and they have contracts with a number of different specialists, probably more than a number, but and they have developed their own accountable care organization network of hospitals, providers, and specialists. And so what they need to report, however, is not just like Dr. Jones saw 14 people and got paid for 14 people and prove that I actually saw them. They need to report out on goals that they set. So are they meeting the needs of their community? Is care being coordinated? And you would say, well, why is the government, interested in the government? The federal government is putting money into states, or more money, that are pursuing this accountable care organization. So why does anybody care about that? And the reason is what we see is in this model, I think it's been proven to be a best practice. And what they see with this model is that when care is better coordinated, we have fewer hospitalizations and few emergency room visits in general. And those are the two drivers of the most expense in the healthcare arena. So accountable care organizations are a model that, because it's decreasing those things, we can see that there's better care, but it's also having an impact on the financing and the amount of money necessary to finance healthcare. So that's why the state is moving more towards that model. When you're looking at, and I would say managed care organizations, the difference with them from accountable care organizations, that managed care organizations are a network of providers. There's less flexibility in that network. And this is an issue for children and youth with special healthcare needs, because you have to think about, if you're signing up with a MassHealth policy, same as if you're signing up with a private policy, what are my child or young adults' needs? And can I get them met if I go to the Boston Children's Hospital ACO? Are there any neuropsychologists subcontracted with this ACO where I could have a neuropsych test done if I needed it? What are the clinics? What are the subspecialty services? Where are they in the state? If I live out in, Williamstown, and I have to come to Boston to be able to see any of the subspecialists, then that could be problematic. Is there anything, what is geographically available to me with this plan? So these are all the kinds of things you need to think about when signing up for a plan with MassHealth. Okay, so MassHealth standard and turning 18. So an individual may be able to get MassHealth standard if they are a resident of Massachusetts. So this is when you turn 18 and you are disabled according to the standards set by federal and state law. So what parents, and I always talk about, and what I hear from the majority of parents is that, okay, my child is turning 18 and I think that they're gonna qualify for MassHealth standard. Because number one, when they turn 18, the family assets no longer count. It's just their assets that count. And so they don't have the assets and potentially, and they're not going to be working. So I think they're going to qualify for MassHealth standard. So what we find is the easiest way, and what most families do, is they apply for SSI. Because if your young adult receives SSI, they automatically receive MassHealth standard. You don't have to do any application. SSI contacts MassHealth, lets them know, you get the MassHealth card in the mail. Now, it may take a month or two, but and I hear from family, the process works pretty well. And also SSI is a little bit easier to deal with than MassHealth. It's just a smoother process. There's not as many people calling. So people have reported to me, in my experience, it's a little bit easier process. So when the thing that you have to know is that you don't qualify. Your child, young adult, does not qualify for SSI until they're 18. And what some people have done is they've said, well, we put the application in when they were 17 and a half, thinking that, oh, great, you know, when they turn 18, it'll all be done, and they get a denial back because they're not the appropriate age. But it's something that you should be thinking about, getting ready for. If your child is, you know, 15, 16, whatever, start reading, you know, go on the Social Security website, you know, think about, you know, read about it, familiarize yourself with it, and know that it's going to be coming.
I have a couple comments and questions if you
Sure.
want to pause.
Sure.
I do have one comment from someone that they want to add that 18 and above clients do have to share parent income if parent is claiming them on as a dependent on taxes.
Yes.
Okay. So yeah, so that's something to think about. Someone on here, they have a green card, and although they've been living in the United States for 11 years, they can't get SSI, and the son is 19. Is that pretty common?
So,
there's something more for SSI.
Well, and I also think if this person wanted to contact me, because I think there's a lot of variables that might be involved with that.
Okay.
Unless they denied them because of, and it also depends. It's something that if they don't mind, I think if they contact me, I can look into it and understand what their variables are.
Right, right. And that's what I'll say to everybody on here. If you have like specific questions, Pat, I'll give you Pat's contact information, and that way you guys can kind of tease some of this stuff out personally, because it's so individualized.
Right. And I don't want to guess, right? Like I could give you a whole bunch of guesses, but if the person just contacts me, then I'll know what the variables are and we'll be able to get it. It'll streamline the process for them.
And Pat, what's the best way to contact you to get a reply back? Is it via phone, email? What's the best way?
At this point, I would say email. Okay. And I would use my personal email because our email boxes, there's a lot in them. So my personal work email is my first initial P for Pat. Yep. And then my last name, Nemia, Nemia, and that's at F as in Frank, S as in Sam, C as in children, N as in Nancy.org. So pnemia at FCSN.org.
Yeah, and I'll also send that in my follow-up email as well to everybody. I'll send you all the contact information.
And I'll put up a slide at the end, but also another good way to get in touch with me is if you go to the Federation for Children's website on the, I believe it's on the left, on the right side, there's an online form for submitting questions about health and education. If they submit that, that will come to me, and they can even put my name in it, you know, when they're filling it out, the question say, please refer to Pat Nemia. So if for some reason they lose the email or whatever, you can always go to the Federation for Children with Special Needs website and get to me through the form.
Okay. Another question. What is the benefit for a young adult to have MassHealth if they are on a family plan? Are you going to go over that next, I think? I am going to get to that and speak about that. So if we hold it for 1 minute, I think we're going to get to that. And then one final thing, and you might be addressing this too, if an individual is on MassHealth before the age of 18, MassHealth standard, because of income, do you know what will change when he turns 18 but still in high school?
So if they are on MassHealth standard and they're turning, if you're going to just remain on MassHealth and you're not applying for SSI, and it goes through your 18th birthday, right? Like while you're 18. But so for example, CommonHealth goes until a child, you can have it until they're almost 20 now. And what I say to people is what you should do is you should always contact MassHealth when things are starting to change. But what you're going to need to do is when your child is going to move from 18, from when they're going to turn 18, if you're just going to be on MassHealth standards, so for example, you're not going to combine it with an application to SSI, then what you need to do is at some point submit an adult disability form.
Okay.
And need to convert so that the determination for a child doesn't remain. You're going to have to, again, another determination from MassHealth that says as an adult, you are, you have a qualifying disability.
Okay, and if they decide to, because I don't think this student is 18 yet, if they are 18 and are going to apply for SSI, that would and they are found eligible to automatically move to the adult MassHealth. Is that correct?
That's correct.
Okay. Thank you. Any other questions? Type them in.
Okay, so I think, so the next thing that, so we said if you don't, and that's what I was talking about, if you don't have SSI, there is still a chance that you can get MassHealth, but you have to fill out the adult disability supplement form, and the determination is made by MassHealth as to whether or not they consider you disabled, and then whether or not you qualify for MassHealth standard. So it's a much easier process to go through SSI, since you're going to have to go through a disability determination anyway. But it is not impossible, if you don't get SSI, to not get MassHealth standard. It's not as likely though. And the income of the household is not more than 133% of federal poverty level. And so this, if you're not claiming them as a dependent, and your child becomes their own household, and so that would apply to them, or your young adult, I'm sorry. And then a young adult who has MassHealth standard can still remain on their family insurance. So that is a question we often get. You can still do that. In fact, you know, MassHealth would probably love it, because again, you would revert back to the same requirements. MassHealth is the payer of last resort. So if your child sees a physician who accepts the primary, then the private insurance is going to be paying that. Versus, and then MassHealth will pay the remainder. Now, it doesn't mean that, so you can use the combination a number of ways. You can use them in tandem. So you can use primary insurance alone. Maybe the provider doesn't accept MassHealth while they're on your private family insurance. You can use that. You're responsible, your young adult is responsible for the co-pays, deductibles, whatever the fees would be. You can use MassHealth standard and your primary insurance and MassHealth standard in tandem. MassHealth standard becomes the payer of last resort, though, if you're going to use them together, which means the provider has to accept both. Or you can use just, your young adult may go to a provider who just accepts MassHealth. And you would just use the MassHealth in that situation. So families that I speak to and I say, you know, why do you do this? What is the benefit to you? I think the responses I get from families is that it offers a little bit more flexibility in access to providers, as well as there may be some timing where if you're going to, you know, a clinic at Boston Children's Hospital, or Tufts, which might be the only clinic that's doing these neuropsychs for adults or whatever the screening is, they might have a longer waiting list because they're the only clinic that's accepting MassHealth, versus if you were able to use private insurance somewhere else. So parents talk about that sometimes the access and the time frame is better. You know, if you have a young adult and they're not remaining in state, and we'll talk about this a little bit for a number of reasons. Maybe they're going to college, maybe they're going to be out of state. MassHealth is not going to pay for someone living out of state or services out of state unless it's emergency related. But your private insurance, different private policies have different private insurance policies have different policies. Sorry, I keep using that word, or rules around that. And so that might be a consideration. You know, how am I going to get the best coverage for my child if they're going to college? So, you know, or if they're going to be out of state for a reason. So it's things like that that you can look at and, you know, talk to your primary insurance about to make sure you understand the coverage that they're offering, and think about whether or not you need a supplement to it. Okay.
Pat, I have a few more questions that are rolling in. Do you want to address them now?
Sure.
Okay. I'm trying to see if they apply for this. Okay. Let's see. So there's a couple, it seems like more personal questions, so it's harder to address those. If a parent is paying for their 17-year-old for Blue Cross Blue Shield at a percentage a month, she heard that the premiums on MassHealth, CommonHealth there's premium assistance, I imagine they're probably referring to. Am I eligible for a reduction of what I pay? Is that referring to premium assistance?
I think it is, and I'm now paying for a 17-year-old for Blue Cross Blue Shield. I heard my premiums on MassHealth. I have. So yes, so you can, if you're to get premium assistance, first of all, you have to have an eligible, and we'll talk about this a little bit more in a second, but you have to have an eligible insurance policy, and and we'll get to that a little bit towards the end, but your insurance policy has to qualify according to the state, and the child needs to have either MassHealth Standard or MassHealth CommonHealth to get premium assistance that will help with the reduction of your payments. And so it is possible, if you already have MassHealth and already have primary insurance, we're going to get to premium assistance. I would call them and say, you know, this is my private insurance, my child's private insurance, and this is my child's MassHealth information. Do I qualify? And they'll be able to let you know right away if you qualify. They'll be able to, in many instances, give you an idea of potentially what the reduction could be, or what they will send you in a check every month. And then there's not too much paperwork. It's an application and a form that has to be filled out by the family and by the employer. So it is possible to get it. You just have to go through the process of applying for premium assistance.
Okay, and then one more. If an individual is over the age of 18 and out of school and unemployed and disabled, he claims he is his own household, but if he can't afford housing but living with the parents, is he considered homeless? So I don't know if that can be addressed here, or if that's a more personal conversation.
Well, I don't, so I think, let me check on that, but I know you can live in a family's home and still be your own household if you're disabled. But I would, I'm not sure. I don't know if anybody on the call on the webinar is aware. I don't think they're considered homeless if they're living at home, but let me double check on that and make sure I have that right.
Okay, no problem.
Okay.
Yep, we'll move on, and then we'll get back to questions in a few.
Okay, great. Thank you. Oh, sorry. Wants to be stubborn. There we go. So we're going to talk about that third bucket now, which is private insurance and government-funded supplemental plan. And basically, why, my child doesn't qualify for MassHealth Standard, but my primary insurance isn't enough to cover the medical. It shouldn't say bills. I think what I meant there is the medical services. So, so what do I do? I can't get the services I need for my primary insurance, so I'm going to have to be paying for it, and I can't afford the bills. So what do I do? So you can, in that situation, people have a primary insurance, they add a supplemental, and they get much more comprehensive coverage. And so a supplemental insurance is an extra or additional insurance that helps you pay for services and helps pay for out-of-pocket expenses for things that are not covered. Most supplemental insurances carry a premium. So CommonHealth is the form of supplemental insurance available to families with children and also to adults that are disabled, but it is a buy-in program, and therefore they do charge a premium, and that premium is sliding scale based on income. So MassHealth CommonHealth, as we said, is a secondary or supplemental insurance. It offers healthcare benefits, and this is an important one for children and youth and young adults, is that it offers the benefits similar to MassHealth Standard. So things like long-term services and supports, behavioral health that may not be covered by your primary insurance. So there are some real reasons to think about this if need be. MassHealth CommonHealth picks up copays for medically necessary services and goods that aren't, the copays that aren't obviously paid for by the primary insurance, and but to use a supplemental, the provider, who could be the doctor, the therapist, the surgeon, the whomever, they have to accept both, because in order to get to the supplemental insurance, the provider has to be able to bill Blue Cross Blue Shield. So if I'm a provider and and a patient comes to my office and I see them for an annual visit and they have Blue Cross Blue Shield, but I don't take Blue Cross Blue Shield, it doesn't matter that they have CommonHealth. I have to be able to bill Blue Cross Blue Shield first. Now, Blue Cross Blue Shield may deny and say, we don't cover annual visits, which that's a bad example, but then MassHealth would cover it. But there has to be the capacity to bill the primary insurance. So that's something that you have to think about when you're considering it as a supplemental. I had a family call me once and they were paying, $300-400 a month on their CommonHealth premium. And they went ahead and got it. It seemed like a really great idea. But then after they had gotten it, they realized their child received, I think it was speech therapy, something else in the home several times a week. And they really did it so that they would get all these co-pays covered. And it turns out that none of their providers accepted MassHealth. And they didn't think about that. And so now they had this thing they were paying for, and it was no benefit to them because the services that they were using were not providers for MassHealth. And it's the same thing if they're not going to accept your primary insurance. So really, in understanding what's going to work best for you as a family, you really need to partner with your providers, talk to them about what they accept, and then make the decision. Do I really need to stay with this provider? Are there other providers? What are my options? And then what is the plan that works best for my child or young adult? Okay. So we've already said this, and I've given you a link here that would take you to information about what the coverage is under CommonHealth. So some important points for CommonHealth include eligibility is for disabled child younger than 19. Actually, some children up to 20 can receive CommonHealth. It's not free. There is a premium associated with it. It's sliding scale based on family income and family size. So, if your family income is higher, your premium is going to be higher. And you need to think about when you get the information from MassHealth, does this work for me? So I have an example of this. I show this graphic, and I'm never really sure why I put it here, but it's something that I wanted to show, and I am always struggling for a place to put it. But if you look at this graphic and you look at children and adult with disabilities, and you look at the percentage they are in MassHealth, we see that they are a smaller percentage than the remaining profile of MassHealth members. And so, it is important to speak up and to make our voices heard, because even though we're in this small percentage, we probably use a lot of the services. So it is important to understand what the MassHealth services are for the population of children and youth and young adults with special needs, and then to really make sure that our voices are heard, because we could kind of get pushed down into this very small group. So MassHealth,
could I just step in for a sec? I have a couple
Sure.
more questions before we get too backed up. Just back to the point about, I think, the coverage for CommonHealth. How long do you commit to CommonHealth, and can you cancel any time?
Yes, you can cancel at any time. And so what I say to parents is, it's not the, if you've looked at everything and you say, what, I think that we want to look at this CommonHealth, and we're going to talk about premiums in a minute. You could apply, and when you get your letter, it'll tell you what your premium is. And then at that point, you can call premium assistance, and you can find out if you qualify for premium assistance and what that would be. And then you can make a decision, like, was this worth it? Is this worth it? Is this the direction I want to go? And I know that it's painful to go through the MassHealth application process. And so I know saying to people, just go, just apply and see what happens is a bigger, is a much bigger commitment of time than that statement implies. But when the system works for people, it usually does work very well. And, you can gather as much information before about what you think your premiums might be, and I'll show you a little bit about that now. But sometimes you just need to go through the process, to find out whether or not you should do it. But you can cancel. When you get it, you have 60 days to cancel. Just don't use it. Once you've used it, you've accepted it. So MassHealth assumes when they send it to you, you've accepted it. So if you use it and then you want to cancel it after that, you might be liable for a premium for one of those months or something, but you can cancel it at any time. Okay. And I recommend you do it. You can call them, but I also recommend that you do it through email so that you have a record of having done it.
And then I had another question about medications. How about medications or other services that the primary insurance is not paying? If, say, example, Blue Cross is not paying MassHealth, if Blue Cross is not paying, MassHealth is not paying too because the primary is not paying. Does that make sense?
Yeah, so pharmacy is a little bit different than going to the provider, right? The provider would be the pharmacy, right, in that situation. So the physician is writing the prescription, but the person fulfilling it is the provider. So a pharmacy is a provider. So you would want to go to, whatever pharmacy that would accept your primary insurance and your MassHealth.
Great, thank you.
Okay. So what do you mean MassHealth CommonHealth charges a premium? I love this picture. So I give an example here on CommonHealth premium calculations just to help people understand it a little bit more. So CommonHealth premiums are based on family income and family size. So if you're applying for a child, also if you're applying for adult, but family size, in this case, we're looking at children. And this is kind of the basic scale that CommonHealth, they use to determine what your premium will be. And so I'll explain how that happens, and then we can come back and look at this. So let's take an example. We have a family of 4 with a monthly income. So MassHealth, they look at monthly, weekly income with a monthly income of $5,000. So that would be roughly an annual income of $60,000 from all sources that are required that are considered income. So we can take those 2 variables, family of 4 and $5,000, and we can find out what percentage above federal poverty level we are. And this is an example of a federal poverty level calculator. If you put into Google federal poverty level calculator, I can't say that too many times, it will pop up with exactly that. And it will ask you how many people in the family, what's the monthly income? You put it in and it gives you your percentage above. So when I used this one, I came up with 233% above federal poverty level. So that's where this family falls. So if we go back to the chart, we see that on the left side, we see above 200% of federal poverty level, right? So those premiums go, so in the next one is between 400. So this blue box of $40 to $192 is between 200 and 400%, right? Does that make sense to everyone? And so again, remember, we're at 233. So we're closer to the 200% side. So we're going to be on the lower end of the premium. So this is not, fine. This is, estimating. But if you do this, if you're looking at things and you plug them in, it gives you an idea of where you might fall in premiums, right? Like if you come up and you're 1,000, you're 1,500% above federal poverty level, you've got a really big premium. So that's what I say, to families. This gives you a guesstimate of about where you fall. If you know that you can't afford any money in a month, or maybe you have a budget and you say, well, I could afford, or my out of pocket is $300 a month. So if I can get that all covered, that $300, and I'm only paying $100 in a CommonHealth premium, that works. So again, it's a puzzle and it's fitting all the pieces together for your family, but that is how the premiums, this is a way to get an estimate of what your premium looks like it could be. So then, you know, but is there something to help with paying those premiums? In the state of Massachusetts, yes, there is, and it's called the Premium Assistance Can Help. So it's called the MassHealth Standard CommonHealth Premium Assistance Program, which means the individual or the child, the family whose child that may be applying for, has to have MassHealth Standard or CommonHealth to even qualify. And if you do, then the state may be able to help with the cost of your premiums. So it helps defray the cost of insurance premiums when a family member has MassHealth Standard or CommonHealth. The benefit is not linked to income, and this is a really important thing. There is no asset test with regard to whether or not you qualify for premium assistance. You know, so that family that's paying, you know, $1,000 a month in a CommonHealth premium, even though they have a high income, they may be able to get some relief. The family member must also be covered by a private health insurance and pay part of the premium, and it must be an eligible insurance policy. So think back to that very first slide when we were talking, or whatever slide, when we were talking about minimal credible coverage in the state. This is where it comes into play. So your insurance policy must meet minimal credible coverage, and it must be a Massachusetts insurance plan, and it must come under regulations of the state, which is a fully funded plan. So, you know, I get a lot of calls because in the state of Massachusetts, we have a number of military bases, and I get calls from people all the time about premium assistance. And the problem is that they have federal insurance, and so they wouldn't qualify. And the regulations around premium assistance are pretty strict. There's not a lot of wiggle room. And so again, I go back to the conversations we were having about choosing your plan. When you're thinking about what plan should I consider, you know, that's going to be the most beneficial, and a plan that might fit into the criteria might be a little bit more expensive, but it might be a better choice because it allows you to then get premium assistance to help with the payments. So let me just say a little bit. I just want to go back. No. Oh, wait. Okay. So, so the process for premium assistance, what I said before, is you have to have MassHealth Standard or CommonHealth. So if you're applying for it, you have to wait till you get it before you can see if you qualify for premium assistance. But as soon as you get it, like that day, pick up the phone, have your private insurance policy information, have your MassHealth information with you, and speak with them and get the process rolling. It is not as arduous a process as the MassHealth application. So you can kind of set that in motion. And they can give you information if you have your CommonHealth premium information. They can give you an idea potentially of what your assistance would be. Now, here's a general rule of thumb. And again, it will give you an estimate. But if you take your primary insurance premium, and for most families, that's more expensive than your CommonHealth premium, and you subtract, you get about what your premium assistance might be. So if I'm paying $700 in my private insurance, and I'm paying, you know, $300 in my CommonHealth, if you subtract that, that's about $400 would be around where your premium assistance might land. Now, there could be other factors that come into play depending on the insurance policy or different things. But that's always kind of the guesstimate that people give out. And you get a check every month from the state that can be used that then for that amount of money, and that helps to pay your insurance policies. If you're the reverse though, and you have, let's say you're the person who has the, you know, $1,000 CommonHealth payment, and you have a $700 private insurance payment. What happens is, so that $300, they just reduce your CommonHealth. They don't send you a check at that point. But that's a much smaller group of people. The majority of people primary insurance is more expensive than CommonHealth and you get a check in the mail. But I think families that it works for, it works really well. And I've talked about these things. It's just kind of a summary. Does CommonHealth make sense for me? You've got to look at your out-of-pocket expenses. You've got to look at what are the services my child or young adult is going to need. And what does that look like financially in combination with my private insurance, my premiums, what my CommonHealth premium is, and does it make sense? If I do get premium insurance, does it help it make sense, right? So it's really kind of, you have to do an analysis of it. And like that was the question before, participation is voluntary. You can cancel the policy. And when the policy is new, you have, I think, 60 days to do it. And then you don't incur anything. If you are using CommonHealth for a year or two and then decide you don't want it anymore, you can cancel it, but you would have had to have paid the premiums during the time you were using it, obviously. So CommonHealth and turning 18, who is eligible? So CommonHealth still exists when a young adult turns 18. And this would be the group potentially, and I am not as big an expert in this area, but if people have individual questions that I can't answer, I do have people who work in the adult arena and I can get you those answers. But who is eligible for CommonHealth when turning 18? So this would be someone, obviously, who does not qualify for a MassHealth standard, right? So they don't meet, for whatever reason, the financial eligibility for MassHealth standard, but they're still disabled and may need supplemental insurance or primary insurance from the state. And so a disabled young adult, 19 or 20 years of age, and I think that's an extension of the CommonHealth from when you were a child, but then a disabled adult, 21 years of age or older, who is working. So there's CommonHealth for working disabled adults and non-working disabled adults. So if you are working 40 hours or more a month, or have worked at least 240 hours in the last 6 months, you can qualify, and I've taken this from the MassHealth member booklet, you can qualify for CommonHealth. And you kind of say, well, wait a minute, why do we want to do this? I don't understand. So the example I use is that there are a number of people who are permanently disabled, but have the capacity to work. So for example, there was a gentleman who lived in Massachusetts who, because of his medical diagnosis, was confined to a wheelchair, but was able to work. And he had a job that paid him well. And he had insurance from his employer. So why? Well, he has a lot of medical expenses, so it helped with the co-pays. And they say, well, was it worth it? Well, and the other thing is, remember back to the slide of the coverage. So this is a gentleman who required long-term services and support. So he was living in his own home, but required some assistance to live independently. So he had a PCA who came in the mornings to help him get ready for work, and he had some additional PCA hours in the evening. And so that wasn't paid for by his employer, the insurance, the private insurance he got through his employer, but by combining CommonHealth with it, he was able to get those services. And if you have a non-working adult who for some reason doesn't qualify for MassHealth standard but does qualify for CommonHealth, I think the only the thing with that is that you are assessed a one-time deductible. So I had a parent call me once and she was saying, I want to get CommonHealth. My daughter, for whatever reasons, doesn't qualify financially. And so this is the other thing that I would say to you is that start thinking early on. Like, don't wait till your child's 18. Start thinking early on and consult people and talk to people, whether it be lawyers. I know, Andrea, you've sponsored the ABLE webinar. Like, start thinking about how should I manage my child's potential assets before they turn 18. So do you need to do special needs trusts? And I am by no means an expert in this, but what are the things that you should do so that your child is most likely able to get benefits when they turn 18? And there are different mechanisms or ways that you can organize finances so they don't impact public benefits. But this woman, for whatever reason, the child had a number of assets. I think some of them were a surprise. She had gotten an inheritance that they didn't know was coming and whatever, so she didn't qualify for standard. And so the mom was trying to decide whether she would also get CommonHealth, and she was on their private insurance policy. And I think what happened with the CommonHealth was that they were going to, because she was a non-working, they were going to assess this one-time deductible, which was going to be $5,000. So, you know, I said to mom, okay, well, let's talk about your expenses. How much are you actually paying? You know, and extrapolate that out over, you know, how long, you know, how long would it take you to pay $5,000 in the coverage? Is it even worth it? And so we kind of went through that to make the decision, but that's the difference. So there is a one-time deductible, which can be substantial with CommonHealth if it's a non-working situation. So now what I wanted to talk to a little bit about, let me just check my time. Oh, we're getting close to the time, so I'm just going to go through this kind of quickly, is that there's 3 steps for filling out your MassHealth application, and you can go through this and it's pretty self-explanatory, and I'm going to give Andrea some handouts that she can share with you electronically to explain it. But there's 3 steps. Whenever you apply for MassHealth, and as I said before, when you're applying, you're just applying. MassHealth is deciding on the information whether or not what you qualify for. So this is where you go to fill out the MassHealth application. I've also included this. It's the MassHealth PDF, so you can read it. Don't submit it by mail. They don't process them very well anymore. If you don't have to, don't submit by mail, but it gives you the ability to read the application, which is sometimes helpful for people. These are just some tips that you should know about. If you're applying for MassHealth, person number 1, and this happens when it's a child. If it's person number 1, it's the person who will be speaking with MassHealth about the child. If it's a young adult, they're person number 1. You may have to provide proof of income. You want to say yes, that for the child or young adult, do they have a disability? They're going to ask you if there's primary health insurance available. Please put that information in as accurately as you can. Make a copy of everything and keep track of dates and things for when you did submissions. And then step 2, you have to fill out a child disability supplement form when you are applying for MassHealth CommonHealth, because you want your child qualified as disabled by the state. If you know your child has a disability, they don't ask you for that if they qualify for MassHealth standard financially, but you may want to fill it out anyway so the determination has been made. So if something changes in the future, you've got that on record with MassHealth. And I'm sorry I didn't include the slide here for the adult disability supplement, but if you are not considered disabled by the federal government or have not gone through the SSI process and you need a determination of disability from the state to qualify for whatever form of MassHealth you're looking for, you need to fill out the adult disability supplement form. Difference: adult is capacity to work, child is functional status, so the questions are a little bit different.
Quick question before you finish up. If you have MassHealth supplemental automatically through SSI, do you automatically have dental too? How about vision?
So MassHealth that you would have through SSI is MassHealth standard. So if you have SSI and you have and you have MassHealth standard, yes, it does cover dental, and what was the other one?
Vision.
Yes. So you do get that coverage, and you can go back and look at the coverage. You can go to the slide that I gave you and you can go back and check all that coverages. But and CommonHealth covers the same things, but if it's SSI, then you get MassHealth standard.
Got it.
Okay. So I think you can read through these things fairly easily. And we talked a lot about this, about how to apply for premium assistance. I've already kind of mentioned all these things, but there is the premium assistance number, if you would like to call it. Wait till you get your CommonHealth or standard. They won't talk to you prior to that, but call as soon as you get it. And again, once when you find out what you qualify for MassHealth, you have to make your decisions. So as a young adult, if your child qualifies for MassHealth Standard, you have to think about what's best for my family and my young adult. Is it best to keep him or her on our private insurance and MassHealth Standard? Do we just do MassHealth Standard? Should my young adult apply for CommonHealth to be a supplemental to our primary if he's working? Well, what are the services that you need that CommonHealth pays for that the other may not? What are the co-pays? Is it worth it? Or is it worth it just figuring out and keeping my child on until they're 26 and they're working, and then they can take care of it from there? So as I say, it's a decision. So again, we talked about this, but insurance options for older adults, just to summarize: MassHealth Standard, if you're SSI eligible, you automatically qualify. If you're non-SSI eligible, you have to go through the disability determination with the state. MassHealth CommonHealth, adult children do qualify for. There's different requirements. If you are, you have to be qualified as disabled, and it's different financial requirements if you are working or non-working. Your child may qualify for other types of other types of MassHealth. But again, if they do, are they comprehensive enough for their needs? Private health plans until the age of 26, all children, no matter where they live, married, not married. After age 26, if your child meets the criteria, set by the regulations, which is that they are kind of permanently disabled, they cannot, and they will not have the capacity for gainful employment, they can be covered after the age of 26. Contact your insurance policy. Don't wait till they're 26. Contact them early. Find out what their definitions, policies, etc. are, what documentation you need so that you can, make sure that you have submitted in a timely manner. And last thing I want to say is about going to college. If you have a child who will be going to college, you need to think about coverage out of state. If they're going to college in state, really, your insurance will cover it, MassHealth will cover it. It's not really a big issue, but my internet got a little unstable. I think I'm back. But, you need to think about these things. So if your child is going to college, you need to talk to your insurance company and find out what the policies are for children at college out of state, what's covered and what's not. If your child has MassHealth, they're not going to receive coverage out of state. So you might have to look into buying the school health insurance plan for them. MassHealth used to pay for the school health insurance plan through premium assistance. That program is being sunsetted, I believe, this summer. So it's just something I call to your attention. There are ways to manage this, but don't wait until your child gets to college and needs the coverage. Find out, talk to people ahead of time, and recognize that if they're going to be out of state, or if they're going out of state to do an internship in the summer, or they want to travel abroad. I mean, if these things are things that your child may potentially participate in, think about them. And that's it. Are there any additional questions?
Oh, yes, we've got a few.
Uh-oh.
So those, we know this is supposed to end at noon, so those that have to get off, go for it. But we do have some questions to finish up. Let's see. Do you have to first apply to MassHealth Standard in order to apply for CommonHealth?
No, because you don't apply for a specific program, right? You just submit an application to MassHealth, and they tell you based on what you submitted. So based on your finances, based on whether or not you believe you have a disability, based on all of these things, they tell you which program you qualify for. So it's one application.
Based on the individual. Based on the
Pardon me?
individual. Based on the individual.
Right.
Applying.
Right. And so, right. Now, if you want to try to get MassHealth through SSI, then, I would do that process first and see, I would go look into SSI and see. And I think that you can talk to your physician, you can talk to programs that your young adult is involved in, and find out, whether people think, that your child would qualify for SSI. In some situations, it's you seem to meet the guidelines, it's relatively clear, you expect it. There are other situations that, it might be a little grayer, and so you might want to get opinions before you go through the process. And the
put
other thing I
myself
would
on
say about
videos.
SSI, the other thing I would say about SSI is if you are denied appeal, because sometimes SSI, and this is just what I've heard anecdotally, gives kind of a cursory review of it, and maybe you didn't build enough medical evidence or something, and so they just deny you. And then if you can kind of build a better case if you appeal and provide better information or more information that's relevant, people do say that they've, they've been able to get SSI through the appeal process. So it's worth a try.
Okay, and just sticking with SSI for a sec, someone did note if you're on SSI and go to school out of state, you can apply for that state's Medicaid, which is good. So a question, another SSI question, if my daughter is going to college or a gap year, is there an advantage for SSI?
Well, it depends where they're, I mean, SSI will provide a small amount of money. It will provide, so you have to look at what, what disability looks like and what the definition of disability is, I think, in that situation to begin with, to see if your child actually really kind of meets that criteria.
Okay.
Because if they're going to college, then you may not be qualifying for SSI because you're going to college and with the expectation that you're going to be gainfully employed. Right. So remember, SSI is a process through which you are, first of all, have to meet financial requirements, but also have to meet disability requirements. And disability is based on capacity to work. So if your child is probably going to work, then you're not going to qualify for SSI, and then you need to think about the other types of insurance that are available to you.
Okay, and a question about premium assistance, is it retroactive for premium assistance?
So I don't believe so. I don't know if somebody else on the call, I don't believe so. I think it's from when you apply, but I will make sure. I've never had that. I know MassHealth is retroactive till 10 days before the date of your application. So
Right.
MassHealth can take a couple months to get through, but right. I think I've never heard that premium assistance was retroactive. I mean, I think if you waited 6 months or a year to call, they're not going to back pay.
Right.
That's why I say to people, call right away. Yep. Because it has to do with the timing of the application, probably for when they start their payments.
Right. And that's what I'll kind of write up a little question and answer based on this too, that we can give, and anything additional we'll kind of research that a little bit. Two more
I'll
questions.
Make sure I find out.
Yeah, for sure. Two more questions. So if I think this is a mother that is becoming unemployed, will have severance, and the income will be, high. If correctly, the only option is to get private insurance, then apply for CommonHealth as supplemental, if that makes sense.
So, so the mom's is unemployed. I guess the question is whether
or likely to become, like many people, but will have severance, put the income over 400.
Yeah, so if you have, so the income's over 400.
And likely it will be 300.
Annually, do you think that means? So
I think so, 300 over the limit. And the only option is to get private insurance, then apply for CommonHealth as a supplemental.
Well, if she's leaving her company, she can, and she receives COBRA insurance, you can apply for CommonHealth. So that's one avenue. But if her finances are such that she doesn't fall in the eligibility category, she's not going to get MassHealth Standard. But she could go onto the marketplace, the Health Connector, and go to the marketplace and see what might be available for her through the marketplace.
Right. So again, like you had said, you don't choose it, they choose you based on what you put in. So it's going to be very individualized based on what you're putting in. So
if what you're saying is that your income is $300,000, that's not going to apply. They're not going to qualify for MassHealth Standard. If the mom stays, if she stays with COBRA, if she has, a private insurance policy, she stays with a COBRA policy or purchases one, she can always apply for CommonHealth.
Okay. A couple more. Let's see. So going back to the question about the medication, the person meant their, Blue Cross Blue Shield is not paying for the children's medication, which means MassHealth is not paying it as well. So I don't know if that, I'm not sure what the question is. So I think because MassHealth's the last resort, perhaps.
Well, no, but I mean, if in fact the pharmacy, accepts Blue Cross Blue Shield, they can bill them. If they deny, they could still bill MassHealth. So the reason is, I don't think it's because the Blue Cross Blue Shield, maybe that MassHealth is denying. There may be something else there that's going on. Like, I wonder is it, a generic versus non-generic issue? Like, did the doctor prescribe something that was brand or generic, and there's a problem with that? Or it could be a couple of things. I would like her to reach out to me, and we can go through the steps of what happened. Okay. And I can get the answer for her as to why that's happening.
Yeah. I think some of these
is a little bit trickier.
Right. And I think that's it's tricky. Let's see, that was what we were talking about with Brandon. Yeah, I will email. Yep. So she'll email you separately on that.
Great.
And one final question, which seems like it might be an individual question as well. We have an application comment. We never received any response regarding our CommonHealth application. Okay. So this last question from someone I think needs to talk to you directly. It seems like a kind of a processing kind of thing. Gone through this process. I don't know if you can see it on the chat or not, Pat. It's kind of a long one.
So no.
Yeah, it's in the chat box. What I'll do is copy and paste that and kind of CC you on it. Because it's kind of a long, we don't know where to begin again, whether to submit a CommonHealth form or we have to start at square one determining.
Oh, no, tell her to email me directly. And I just put up the slide, so if anybody didn't get my email when I said it, send it to my private email, or go to the Federation for Children. Like I said, if you forget my email or you lose it, go to the Federation for Children with Special Needs and fill out the question and just say, please refer to Pat Nemia. But I get most of the MassHealth questions, they don't stop, they just shoot right to Pat. So, and that's another way to get to me if you lose my email. But
absolutely. Yeah. So everybody on the call, if you have individual questions, again, I'll send, you have this stuff up on the slides. We'll send the slides. We'll send the webinar. We'll send all the handouts. I'll have Pat and I will collaborate that and get it out to you in the next day. And yeah, thank you, Pat, for this. And what a turnout. And especially through everything going on, I think this is the best way to stay connected and informed. And I'm so grateful to have these connections.
Well, thank you, Andrea. And I want to say just one last thing. I know I said to you I would say it in the beginning and then I got rolling. But I do want to say to people who are on MassHealth at this time during COVID-19 that during the state of emergency and 30 days past, MassHealth is doing no redeterminations and no changing to people's status on MassHealth. So people didn't have to be worried, that if they got sick, they wouldn't have coverage. But 30 days after the state of emergency is lifted, they are going to go back and they're going to look, and people could begin to get calls or information. So just be aware of what you think your MassHealth status is or could be. If you have had changes in employment, if your income's gone up or gone down, you can still call MassHealth and let them know those things. They're not going to do any redeterminations, but it will help later on with with how, when things change back, with how smoothly that transition goes. But be aware that there is going to be another transition. Redeterminations are going to start to be made. And if you have any issues, please call me or email me because I can help you figure out what to do with MassHealth. Okay.
And how to close this out, someone asked, are all these services from Mass Family Voices free of charge?
Which ones? Yes.
It's all free.
Oh yeah, you can call me. If you call me, I do my webinars, I'll do whatever. Yeah, email me. There's no charge to reaching out to me. I mean, that's part of my grant funding. So call me, I'll work with you, I'll connect you with people. Everything's free.
Right, just to be clear, you're grant funded under the Federation of Children with Special Needs. So yes, that's
Exactly.
what the Federation does, is all these great things for all of us. So we really appreciate it, Pat, and taking the time. And you and I will be in touch to gather the information and send it to all the attendees.
Great.
All right,
All right,
Pat, you
everybody,
take
thank you so
care,
much
and
for
everybody
coming.
take care.
Bye-bye.